botched plastic surgeries, how can patients be sure that that's not going to happen to them?
I think it's difficult. You know, I do a lot of revision type surgery, so I see more of this than a lot of people do. And I think, you know, calling it always a botched procedure is a little bit off the mark. Certainly there are cases where, you know, there were errors of judgment, errors of technique, sometimes both. Sometimes things were done reasonably well and just didn't turn out right, and something went way wrong during the recovery process. But I think, you know, for the patient who's trying to figure out how can I avoid getting into that situation like these crazy things that we see on TV, I think the key is to find a surgeon, board-certified plastic surgeon, who really has the experience to kind of recognize when things go wrong and fix them. You know, that's the real difference.
I think that's absolutely correct. And I think when patients are trying to figure out what surgeon they should visit with and what procedures they're interested in, they need to really follow a checklist. And I tell them to kind of keep it in mind of the 3 C's. And I think the first thing I tell people is check the credentials of your surgeon. Second thing, check for the reviews that your practitioner might have. And that helps patients understand whether the patient is going to be examined, seen, and have the right procedure selected. And then the last thing I say is it's a double check at the very end. Double check with yourself as the patient that you're ready for the procedure, that you understand what's necessary to recover appropriately, and that can also help keep you out of trouble.
I'm a little more suspect about the quality of reviews. Even a non-core physician doing plastic surgery is going to get the occasional good result, and maybe they've got a good social media campaign and they're going to get the word out that they're really something that they're not. So that doesn't necessarily give the same quality of information.
It's just another area for them to analyze and make an informed decision. I think that there needs to be some basis behind the review that gives a little bit of the journey the patient went on, a compendium of what your practice represents and what the patient can expect.
Do you think that the nightmare images that we've seen can stem some conversation and have a lot of people asking more questions?
Yeah, we want educated patients. We want patients who are going to ask tough questions because we're the ones that have the answers to those questions. And they see these extreme procedures, and you know, on television, oftentimes there's a message there that, you know, you really took this too far. You pushed and you found somebody who was going to do something that you should not have had done. And so it's not always just that the surgeons made some grievous error. A lot of times it's these other things that play into that.
Great advice. And one way you can arm yourselves with a lot of questions is by going to theplasticsurgerychannel.com for more answers.